Patient flow is a phrase we've used to describe how patients actually move through the healthcare system. And it's best thought of actually about what are the consequences if patients don't flow in a timely manner through the whole of the healthcare process. So we get, for example, things like patients waiting for a long time in A&E. We get patients waiting in ambulances outside of A&E. We get patients waiting in a bed to move on to a nursing home or some other sort of home help support. So the issues that we need to address around patient flow actually consist of getting the balance right between patients arriving at a particular point in the system and the capacity to treat them. So that mismatch between the demand that patients presenting, say in A&E, and the amount of staff we have on duty to deal with the patients that are arriving is really important. And that's one of the things that we need to get right to enable patients not to spend excessive amounts of time, for example, in our A&E departments. So in Wales, we're looking to address the whole patient pathway, not just individual parts of it. So if patients are waiting a long time in A&E, it might not be that A&E is the problem. It may be that there is a blockage further down the pathway that we need to address. So success for the programme will be when the symptoms that we see around patients waiting at various stages in the process are not waiting so long, or there's less of them waiting. But a further success will be that those in charge of monitoring and managing our overall healthcare processes will be using the data to help them proactively spot problems in future.